Well, welcome back to the Pressing On podcast, where we amplify voices of perseverance, highlighting the journey of hospitalized families so that all of us will be encouraged to press on. I'm your host, Richie Reeder, and you can learn more about my family's hospital and pediatric transplant journey, as well as take advantage of all of our free resources and Pressing On programs on our website at pressingon.org. For the latest Pressing On news, volunteer opportunities, and program information, be sure to subscribe to our email newsletter at pressingon.org and follow along on social media with Facebook, Instagram, and also subscribe on YouTube. Today, in episode 13, we welcome my friend Jen Lau, who leads Bear Inc. Jen has held several leadership roles in transplant organizations, including the Society of Pediatric Liver Transplantation, Split, and the Starzl Network. She's currently a member of the OPTN Board of Directors and Expeditious Task Force, and in January 2022, she co-founded Bear Inc., the organization that she now leads. Jen has a bachelor's in mass communications and is currently pursuing her master's in public health. She resides in the western suburbs of Chicago, Illinois, with her husband, Alex, and their 2 children. In 2011, Jen welcomed her eldest son, Nate, who was later diagnosed with biliary atresia, BA for short. At just 9 months old, he received a life-saving liver transplant from a living donor. It was then that Jen discovered her calling to advocate for pediatric liver disease and transplantation. In today's episode, she shares their liver transplant journey with her son, Nate, the special bond and unique role that living organ donation creates, how to give yourself grace as a parent, and how giving back has turned into a great passion for her. Get ready for a special episode from a wonderful family. Here's Jen Lau. Well, hey everyone, it's my honor and privilege to have Jen Lau of Bear Inc. on the podcast today. I value Jen not only as a transplant parent and an advocate in this transplant community that we're a part of, but also as a healthcare professional as she founded Bear Inc. Jen, we just want to say so much thank you. We appreciate you for joining the podcast today.
Thank you for having me. I'm completely honored to be here with you.
For our listeners out there that might not be familiar, would you share a little bit about your role with Bear Inc.? And then we'd love to get into your family story eventually here too.
Yeah, sure. I had founded Bear Inc. In February of 2022. So we're still young as an
Yeah,
organization. I co-founded it with I like to say my partner in crime,
yeah,
Jordan Sarbaugh. Whom you've met actually.
yes.
And so her and I, we created BEAR, which is for Biliary Atresia Research and Education. And really, the idea behind it was to have a national organization out there for the disease, and also to be support for families going
Mm-hmm.
through it. When her and I met and started to discuss, we were sitting here thinking, there's not one organization out there for BA. And
Yeah.
if, for listeners who don't know, biliary atresia is the number one reason why pediatrics transplant. So
Mm-hmm.
we felt like it was time. So we founded the organization together. And ever since then, we've been running 100 miles a minute, which is good.
Yes.
Yeah,
Yes.
it's good for, it's good for the families. It's good for, just really the entire community, physicians, other organizations, patients and families.
Mm-hmm.
So we're really, really excited, even just at the infancy of the
Yeah.
organization.
Well, we really appreciate the great work that you all do. And while my, daughter has been affected by another genetic disease, methylmalonic
Mhm.
acidemia, we know so many folks in the transplant community that are affected by biliary atresia. And we want to get into that specific diagnosis in a little bit, but
Yep.
share a little bit about your, family, and maybe how you got into this transplant and biliary atresia conversation.
Yeah, so myself and my husband Alex, we have two beautiful children, Nathan and Allison.
Mm-hmm.
Um, Nathan was our firstborn, and he was what we call our $1 million and more baby. Um, Nathan was the one that was diagnosed with biliary atresia.
Yeah.
And so it has, and then Allison, I will say Allison has just been a breath of fresh air, to give
Mm,
us, an idea of what it's like to kind of have that quote unquote normal parent child relationship.
mhm,
Nathan, so with Nathan being our first, being diagnosed with BA, we've really just, it was a whirlwind from the beginning.
mhm.
Um, as a parent who's so excited to have their firstborn, you have so many goals, right? When you find out you have
Yeah.
a son, you're like, yes, he can play for the Bears, he can play for the club. You like have all these things in mind, right?
Uh-huh.
Um, and then when you know something's not right with your child, and you advocate for that,
Yeah.
and it's like your worst nightmare as a parent comes true once you get
Mm,
that diagnosis, whatever that diagnosis may be, right? I mean,
mhm.
so from
Why don't you take
there,
us into that story a little bit? Like, what was
yeah.
that like? You mentioned like the excitement of, hey, firstborn son. Um, what did that diagnosis look like for you guys? How many hours or days into
Oh.
things did you know that that was the diagnosis? How did that
Mhm.
feel as a mom? Take us into that story a little bit.
It was very scary,
Mm,
because as a first time parent, and one that was never part of the medical community before,
mm,
you had no idea. So when Nate was born, he he was jaundice, but I was told most kids usually are, at the first part of birth. So
mhm,
I didn't think anything much of it because neither did the nurses or doctors at the time in the hospital. His bilirubin was slightly elevated, but that
mm,
was really about it. So I had him C-section. So we were there for
mhm.
about 3 days, and then we came home, and my husband and I were kind of like, okay, now what?
Yeah.
As new parents, you get the hospital staff to help you,
And
of
you're
course.
recovering yourself
Right.
too. Yeah.
Yeah. Yeah. So you're recovering too because, technically, it's an abdominal surgery. So there's recovery time there. And my husband was amazing. Really helped out. I had my mom help me out. Our parents live close by. So we have that family support too.
Mm,
And so we come home and think nothing of it. We
wow.
learn the kid's cycle, sleep cycle, eating cycle. We sleep when he sleeps, we eat when so you just kind of learn all of that first, as a first time mom and a parent. And then we had our first checkup. Everything seemed okay. Um and then that's after the first checkup, that's when I started to think, okay, this just can't be right. He's still
Mm,
jaundice. He looked even more jaundice. Um, his stool was normal, which we all know in the liver world, stool
yeah.
is it's the book that you
Sure.
follow. Um, but he started to become more agitated, didn't sleep much,
Mm,
constantly, so like cluster feeding.
yeah.
Um, but just not, it seemed like he just wasn't getting enough all the time.
Mhm.
And he was formula fed. He just
Okay.
did,
Yeah.
yeah, so he did not take to breastfeeding very well. So my husband and I were just kind of like, we didn't know if it was right or wrong. This is our first kid. We're learning.
Sure.
And so I had called the pediatrician and said, he's still jaundice. And the nurse had said, well, that happens when you breastfeed babies. And I'm like, I'm not breastfeeding my
Right.
child, so he's
Mhm.
still jaundice. Can he be seen? So he was seen. The doctor, and this was at this time, then this was about at 6 weeks.
Okay.
So that's kind of the cutoff in biliary atresia for a treatment, which I'm sure we'll probably get later into, that works or doesn't work leading up
Mm.
to transplant.
Yeah.
So we're right at the cusp of that. So we go in, we see the pediatrician, and he's like, he runs some labs.
Mm-hmm.
We ran the labs, and my husband went in with Nate. I couldn't do it.
Mm.
Now I can do labs all day long. It's like second nature, but
Sure.
you know, I was very emotional that day. So, because I just knew in my gut something was wrong.
Mm.
So we did the labs and we went back over to the pediatrician's office, and
Uh-huh.
he told us, go home. I'm going to send you right away to the children's hospital.
Wow.
I will call you, here's what I'm thinking. We might do an ultrasound prior to you guys going over to the hospital. So why don't you guys just go home, rest, and I'll call you with next steps. So at that point, that's when I knew,
Was that
something.
the first day that you heard the words biliary atresia?
It was. It
Yeah.
was the very first day. So I had known, I'm like, okay, this can't be good. But you just stay hopeful for each other, we're like,
Mm-hmm.
okay, we'll go home, we'll wait for the phone call. So we went home, waited for the phone call. They wanted us to get an ultrasound outpatient out where we live
Mm-hmm.
first. So
Mm-hmm.
we went and did an ultrasound. And the next kind of red flag for me was the ultrasound tech looked at me and said, "You didn't feed him or anything, did you?" And I said, "No, no. We were told to, not feed him until, the test was done."
Mm-hmm.
And well, I can't find his gallbladder. Let me go get someone else. Maybe I'm just not doing it. So they're having that
Wow.
conversation with me. And I'm like,
Yeah.
so they're showing their cards when they probably shouldn't.
Sure.
So then another person comes in, and um it's just, you look at their faces and right?
Mm-hmm.
Faces kind of tell everything. So
Yeah.
so then I remember leaving, they finished up. I remember leaving the room, and I told my husband, I'm like, this just is not good.
Mm.
And so we went home. And at this time, then, I was a nervous wreck. He was a nervous wreck. So we called our parents. Everybody came over to the house. And
Mm-hmm.
and from there, Nathan started to get even more agitated, arching his back a
Mm.
lot, just not feeding, just not feeling well. You could just tell.
Mm-hmm.
And so while we were kind of like getting everything in order, because I had a feeling we were probably going to be headed down to children's. So
Yeah.
um sure enough, that night then they admitted us and everything started.
Yeah.
And that's when I feel like you open your door from being one type of parent to another type of parent.
Mm.
um
Say more about that.
So, in the beginning, your environment, you're in home, right? You're at your
Mm-hmm.
home. So you're
Yeah.
you're more comfortable. And also you're still kind of in this headspace of, well, maybe everything's okay, right? Maybe
Yeah.
it's gas. Maybe it's, you're thinking of all these normal kid things that even babies do go through.
Mm-hmm.
And then when you walk into a children's hospital, it and you open that door, it's just a different feeling.
Sure.
Um, you are literally walking into a new world, and that is going to become kind of like your new norm as a
Mm.
parent. That's going to become a new norm for your child.
Mm.
But I will say, when we did walk through those doors, I knew we were in the best of hands.
Absolutely.
And that's the part that gives you the hope. That's the part
Mm.
that gives you a sense of calm during this storm that you're going through, with your child, with your family.
Yeah.
Um,
Now,
s-
when you were at that point right there, what options were on the table? You mentioned before, about possible treatments that may or may not
mhm.
work in a time frame. What were the doctors saying to you, when you guys were hospitalized at that point in time?
So when we were hospitalized, right away you have like 12 gray coats come walking into the room, right? I mean, you are just you are
Overwhelming.
overwhelmed with
Yeah.
medical professionals in the room with you. Um, and ours even came in, they even brought in a whiteboard so that they could
Mm.
start like drawing what the liver looked like and how this was supposed to work, et cetera, et cetera. So we're getting education too at the same time. Um, it was the only option in Nathan's case because we were so close,
Mm.
was to, they, if I remember correctly, they probably ran their own labs. And then from there, he went to straight to a liver biopsy.
Yeah.
So after the liver biopsy had confirmed that it was, in fact, biliary atresia,
Hmm.
the next step and the only step for him was to get what they call Kasai procedure.
Mm.
And then from there, the hope was that it would at least prolong him from needing a liver transplant. We talked about liver transplant that very night. And
Wow.
I think that's when um it kind of reminds me of, like the Charlie Brown episodes where he's in the classroom and you hear the teacher and it's just wah wah
Wah, wah,
wah wah.
wah, 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 wah.
Yeah.
Yeah.
At that
Yep.
point, you don't hear anything. Um,
Hmm.
I know they discussed tons of things with us, but my mind was just wah wah wah
Yep.
after I heard those words liver transplant. Um,
I appreciate you saying that because a lot of the parents that I talk to, like sometimes there'll be some type of guilt that's like, oh,
mhm,
I should have known this, or I should have listened to this, or I should have seen my child doing this, and I should have known. And the reality is none of us could
no,
foresee these things coming. So maybe
no.
take a pause in your story right now for a moment.
Yeah.
Like, what do you say to that parent that obviously like give yourself some grace? It's okay to not understand everything at first, but what do you say to that parent that might be in a similar situation, that everything that the doctors are saying is just so overwhelming and it feels like white noise? Like, speak to that parent for a second.
Um, it's exactly what you said. Give yourself some grace. Especially those that are new parents that have never,
Mm,
I mean,
right.
even not new parents. It's one of those things where one, you have to give yourself some grace. Everything that you are going through and everything that your child is going through is nobody's fault.
Right.
Um, and I think that once you realize, I mean, you're always going to have the parent guilt no matter what. Like
Hmm.
I remember asking Nate's doctor, I had a turkey sandwich before I gave birth. Was it the turkey sandwich? Was it something I ate? And of course, he was so sweet and nice about it. He's like, "No, it was not your turkey sandwich."
Hmm.
So it is. And I've learned it took me many years after that I should have gave myself that grace as a mom.
Sure.
Because the mom's guilt, because you're carrying the child for 9 months. So that
Hmm.
mother's guilt is probably the worst type of guilt that there is. Um, and so if you, uh, what helped me get through that was, giving myself the grace, leaning on my support system, leaning on my
Yeah.
husband, my mom, my dad. Um, I even leaned on the priest that would come in with us. So I had my
Hmm.
faith that I would lean on. Um, and friends that were around me the entire time, basically reassuring me and telling me you're doing everything you can do as a new mom right now. Um,
Yeah.
that speaks volumes. So just making
Hmm.
sure that, you really have your tribe with you
Right. Right.
through this. And for those that don't, um find somebody,
Hmm.
whoever you have that trust in, just find somebody, whether it's a physician, whether it's your parent, whether it's a priest or, someone of religious faith, somebody to confide into, because
Sure.
you're going to need that, because you're
Right.
going to go through so many twists and turns.
I'm always amazed at I've heard so many parents tell their stories of there are people in their support system that just rise to the top that completely surprise them. That's like,
Yeah.
I felt so supported by this person during our healthcare trauma. And
Yeah.
then unfortunately, in most situations too, there's people that you think are going to come to the forefront for you that it's too much of an emotional
Yeah.
trauma for them that they kind of shrink back for a little while during that season. And for folks to kind of understand like that's okay, it's normal, it's going to happen, that
Yeah.
some people surprise you and some disappoint you, but the most important thing to focus on is who is in my circle and
Yeah.
who can I lean on right now for sure.
Hey friends, I'm Reagan Reeder, co-founder of Pressing On, and I love providing leadership to the organization as we uplift, resource, and coach hospitalized families, many of whom are on the journey of pediatric transplant. This season of the Pressing On podcast is sponsored by our friends at CODA, the Children's Organ Transplant Association. You can look them up online at coda.org. CODA helps children and young adults who need a life-saving transplant by providing fundraising assistance and family support. They're the trusted leader in supporting transplant families financially for a lifetime. CODA has helped raise more than $125 million for transplant-related expenses since 1986 and have seen approximately 2,400 CODA patients transplanted successfully. CODA is a 501c3 nonprofit organization, so funds raised to help meet the needs of transplant patients are not considered income for families, and CODA's services are provided at no charge to transplant families. As the mom of a transplant recipient, I'd highly recommend their services because I've seen firsthand how CODA's compassionate care and financial guidance has helped our family since my daughter's transplant before, during, and after her transplant in 2017. For more information on how CODA might assist your family financially on the transplant journey, head to coda.org. That's COTA.org.
I'm curious and interested in your story specifically from those early days in the hospital to when you got the diagnosis. Take us from that diagnosis up through, the point of actual transplant, what that was like to be, listed and, in your case, soliciting a living donor. What was that process like for you guys?
So do you have enough time? No. Um,
Absolutely.
no, so from the time of diagnosis, we after the liver biopsy, we did hit a little bump, which brought Nate back into the ICU for a couple of days. And from there, he needed to have a, an abdominal life-saving surgery. The liver biopsy that he had, there was a complication with it,
Mm,
and so they had to correct that complication first.
okay.
And they wanted to make sure then that he was stable enough then to go through the Kasai procedure,
Yeah.
which is taking the intestine and hooking it up to the liver to make sure to see if bile would flow that way.
Mm,
And so we had to wait about 3 days in the ICU before he could go back again into the OR to receive the Kasai. And then once the Kasai happened, I remember sitting down with his surgeon, a great guy, and I remember him just saying, "We're just gonna have to wait and see. We're giving him a 50-50 shot here." Because
mm,
we were so just so close to that, that time frame that they like to do the Kasai.
yeah.
Um, so from there, we were still inpatient for a while because he just wasn't feeding correctly. He wasn't feeding properly. We are trying to get his formula, uh, just it was a balance for him.
Hmm.
So we stayed probably inpatient, probably a little bit longer than what the team really wanted us to, but I wasn't feeling comfortable. They wanted to send us home with an NG tube, and I was not having it at the time. So they're like, okay, we'll do it your way first, and then if it doesn't work, then you're going home with an NG tube. So it's like, okay.
Sure. Sure.
So, a couple days later, finally Nathan was coming around. He was feeding. He was doing everything very well. So don't knock a mother's instinct, people. And then so we went home and we waited. It was 3 months of let's see if the Kasai works.
Mm-hmm.
He was heavily, closely followed by his team with checkups and with the pediatrician as well. We've had, um, you know, more inpatient, you'd go to clinic and they'd look at them and go, oh, we're gonna have to send you upstairs inpatient. You're like, man, we
Right.
just missed. You always go to clinic with your bag packed because you know
Yep.
that's going to happen.
Yep.
I'm just going to say that now. So a little,
Mm-hmm.
follow me for more tips, right?
Yep.
Um,
Yep.
so we, we went through a lot of inpatient back and forth, back and forth. And one of the clinics, I remember his doctor basically saying, in order to give Nate a chance of life before 1 year old, the best way to do it is through a living donor.
Mm.
And this was 12 years ago.
Yep.
So living donation 12 years ago was very different than, as you see today, so many more centers and people
Mm-hmm.
raising their hand and saying yes to living donations. Um, so back then too, it was harder to receive a liver from a deceased donor list.
Right.
Um, so my husband and I just kind of like took it in stride and said, okay, what do we got to do? Like, tell us what we need to do.
Mm-hmm.
If that is a way to save that's when survival starts kicking in and you do
Mm-hmm.
whatever you need to do to save your child at that point.
Absolutely.
Um, so from there, we asked, can we get worked up?
Mm-hmm.
Um, my husband wasn't the right blood type.
Sure.
I was postpartum, so
Yeah.
I was out of the picture, because I had just had a major abdominal surgery. So I
Mm-hmm.
was still recovering. So from there, we started seeking out to friends and family.
Yeah.
And, of course, you follow all with living donation. There's in the liver, there's criteria that you have to follow. Certain blood type, certain BMI, certain just certain, physical and healthy attributes that you have to have.
Yeah.
And so we started that journey. We started that process of finding a living donor for him.
Mm-hmm.
And, it was just all word of mouth. I mean, this is something where social media was not, I mean, it was there, but,
Right.
Tom from MySpace was the coolest guy at the time. So,
Now, during that time when you're anticipating, okay, we're headed towards transplant. I think, one of the organizations that's near and dear to both your family and mine is the Children's
Mhm.
Organ Transplant Association.
Oh,
And
love
while we
them.
knew of one another online and the great work that, our organizations were doing, we were actually able to meet last month in person at their Miracle Maker event, which is awesome to always,
Yes.
meet folks that you're like, we know of what you're doing and we respect you from afar, but to be able to be in the same room and give hugs and see one another face to face
Yeah.
is a precious thing for sure. Maybe speak to what the Children's Organ Transplant Association, CODA, was able to do for your family during that time.
So, um, I mean, Coda has been so instrumental into the journey. And, thankfully, yes, we were finally able to meet, through Coda too. They were part of the family. I mean, they
Yeah.
just, I mean, it is amazing what they do. They come in, they embrace your entire journey, no matter what that looks like. Um, and they're there to support you. They're there to walk you through, um, you know, that entire process of becoming a Coda family.
Mm-hmm.
Myself, at first I had a hard time letting go because I wanted to control that. I mean,
Sure.
What parent doesn't want to? And I just remember them saying like you need to take care of Nathan. We will take care of the fundraising. We will take care of, what needs to be done to make sure that you
Mm-hmm.
guys are okay. And from that moment on, I was able to just exhale just a little bit because I knew that was one less thing off my plate. Because one thing that you don't realize is all the um expenditures that happen. As
Mm-hmm.
you know, for us, I mean, we pay, it's parking fees, it's even
Right.
even toll fees and
Mm-hmm.
gas and the cafeteria hospital food and the
Right.
bad coffee and just I
Mm-hmm.
mean everything that you can possibly think of. Those things add up. A week's stay in the hospital, it adds up.
Mm-hmm.
So it was nice. It was amazing, and just we were very grateful to have them be able to say, we got this. You need to
Right.
take care of Nate.
Now looking back, like
Mm.
from the time that you guys were kind of word of mouth soliciting, for a
Mhm.
living donor, take us into the story at that place and time when you realized, oh, okay, this person, fill in the blank, is a match, and we're going to move forward with this, and then how the actual surgery went and recovery. Take us into that part of the story.
Yeah. So we were inpatient, of
Okay.
course. We had another bout of cholangitis, and which is an infection, within the liver. And I think we were on like day 8 of just we've had enough. We were on
Yeah.
day 8,
Sure.
and I it was during rounds, but I got a phone call, and it was one of the individuals that we were working up to be a living donor.
Mm-hmm.
Um, and she called me and she's like, "Do you have time?" And I said, "Sure." And she told me that everything went well. She went through all the rigorous testing that she had to do, and that she was a complete match for Nathan.
Mm-hmm.
Um, and I just remember like just crying, just bawling my eyes out.
Mm-hmm.
And all the doctors were like, "What's going on? Are you okay? Like, did you receive bad news? Like, what?"
Sure.
And, so I had told them right then and there that, this individual was a match for Nathan. And then I had them crying. So
Mm.
it was just, everybody was so thrilled, so happy. Uh, um,
How soon
so
after that did he receive the transplant then?
So we scheduled transplant, because then, you have to go through specific workups and things of that
Sure.
nature. So we had transplant a month later. They scheduled it a
Okay.
month out. Um, and she was over at the adult facility. Nate was over at the
Mm-hmm.
children's facility, and it went swimmingly. I mean, just textbook is what I was told. She did very well. Um, Nate did very well. And I mean, she was over in his room visiting him by like the second day after
Wow.
her, yeah. So
Wow.
it was it. And at that time too, while we're going through transplant, you're getting messages of updates about your kid, and then you're running over to the adult side and trying to get updates on the donor, and
Sure.
you're just ping-ponging back and forth all day with a lot of coffee in hand. And
Yeah.
um but it was so amazing. We had like a camp set up on the one side of the hospital, another camp set up of people on the other side. I mean, it was amazing. It was truly, truly amazing.
Wow.
So
What a life-saving sacrifice. I mean, just such honor and respect for folks that are willing to, give the gift of life. Um, you know,
absolutely.
let's just plug, donate life, right now.
Yes.
Like if you're listening to this podcast and you are not an organ donor, I mean, please go register right now.
Hey everyone, I'm Olivia Reeder, and I love helping my parents serve hospitalized families through our Pressing On programs. Here at Pressing On, we're committed to meeting tangible needs, and we have various programs that help resource hospitalized families physically, emotionally, and spiritually, including our Hospital Care Package program, Transplant Backpack program, Gas Card program, Crisis Coaching program, and Children's Hospital of Pittsburgh program. So if you or a family you know is affected by a long-term hospitalization or is on the journey of pediatric transplant, we'd love to come alongside you with free resources during this time. Let me encourage you to visit our website at pressingon.org to sign up for our free resources or make a referral to one of our programs. Visit pressingon.org today. Thanks so much.
Maybe as a mom, you can probably reflect on this better than anybody because, I mean, you've spent every waking second with Nate up until this point. What was he like prior to transplant, and then what dramatic changes did you see physically in him
Oh,
after transplant?
so a lot of BA children, we always kind of say they kind of have that like old man um like belly body. So like a very very skinny up top and then just like this belly, right?
Sure.
And that's because, the nutrition that they're not getting, they're not absorbing
Hmm.
with the disease. And so, and then of course, with his jaundice, and just not doing the typical things, as he should have been doing. Post transplant, this kid, um, I mean, he's sitting up in bed by day 2 on the normal floor. So he was 9 months old at the time when he received
Okay.
his transplant.
Yeah.
So we go from transplant to being straight to the ICU then so that they could monitor him. And I remember them saying, like, you'll have a couple days, so go home, get as many showers in as you can, get as many naps that you can.
Hmm.
And so as I actually was about to do that, then my husband calls and he's like, they've already extubated him. I mean, it
Wow.
really wasn't even, I don't even think it was 24 hours later.
Wow.
And so I like rushed back over and tube was out. He had already tried ripping out already some IVs and things of that nature, and I was able to hold him right then and there,
Wow.
which was
Wow.
so amazing. And then from there, they're like, "Well, I guess you're not really gonna get a nap now because you're going upstairs." I was like, "Okay." And from there, that kid has never looked back. I mean,
Ah.
he was sitting up right away, smiling, eating, laughing, playing. I mean, just everything. The reason why you transplant someone, right?
Mm.
All the things that kids should be doing, he was doing. And
Hmm.
he has not he hasn't stopped since. So
Now,
um
I mean, obviously a lot of time has passed
yeah.
since his transplant to where he's at now, but like, what does medical care look like these days? How's he doing overall? What things is he involved in? Like, what's Nate's life look like now?
Yeah. So he, of course, in true Nate style, we've hit some many bumps along the way. But that's okay. Because, he's still here with us, right? So
100%.
yeah, so I mean that's the way I've always looked at it is he is still here. So we will any little medical bumps we have, we will hit them head on. So Nate has he's actually has EOE post transplant, which is the eosinophilic esophagitis. It took me 6 years to say that correctly.
Mm.
But basically he received that diagnosis post transplant, and he's had just horrible itching. He started
Mm.
probably I would say at a young age of 3, and that one's kind of been a big to do, a big conundrum post transplant as well. But I will say, everything along the way that he's actually hit, um we're in good hands. I mean, his team, even if it didn't directly affect the liver, his team still handled the situation.
Yeah.
Um, and we have gone through, I would say, the ringer of treatments in regards
Hmm.
to the itching and in regards to, prior to finding out about his EOE. We, just tried so many different things that kept just not working for Nate. And he was quite the head scratcher for his team for quite some time. I mean, they even sent us off to other centers for second opinions and third
Hmm.
opinions and fourth opinion. I mean, they were not giving up. I was not giving up.
Yeah.
And finally, I think we're in a really, really good place. We may, he's receiving treatment for the EOE and getting to just back to life. And as far as his itching is concerned, he's receiving treatment for that. We don't know the diagnosis behind that still, but I'm not going to poke and prod anymore. The
Yeah.
treatment's working, so
Right.
like he's able to just kind of get back to normal 12-year-old things that they should be doing
Yeah.
instead of worrying about all of his medical things. So,
Well, and I think you can speak to it as a parent. I know I feel this pride and joy at times when you've seen your child, lying in a hospital bed and you're not sure what the next moment, the next day, the next week is
mm,
going to yield, and then you get the joy of seeing them enjoy, things that people would deem normal child type stuff.
right.
I'm watching my daughter Micah Joy do gymnastics this fall, and I never would have thought that that would be a thing, and she's just having so much fun. Like, speak to that for a second of
Yeah.
like that joy that you have as a parent, like watching your child get to enjoy things that you never really truly knew if they'd ever have an opportunity to enjoy.
Oh, it's the best. It is the best feeling I mean, it just to see their face just light up, and their personalities come out on things that they're doing that they enjoy. Again, you don't transplant a kid to put them in a bubble. You transplant the
Right.
kid to live their life, right? And
Say it louder for the
oh
people
my
in the
gosh.
back.
And that outcome is so important. It's not the 1 to 2 years afterwards. As a parent, you're thinking about 5, 10, 15, walking down the aisle, going to college, playing sports, doing all the things that they love. That is the outcome of transplant.
Hmm.
So, Nate just this past summer started baseball, loved it.
Nice.
Finally got the blessing to play a sport.
Love it. Love it.
So he enjoyed that. He enjoyed that. He enjoys fishing. He enjoys I mean, he enjoys video games. Mom does not, but I let him enjoy it because, he's here with us, right? So,
Absolutely, absolutely.
yeah.
Now I'm curious. I mean, one of the things that I started the podcast with is how much we appreciate people like yourself, that you've gone through something hard. You've watched
Mhm.
your child suffer. Not that everything's perfect now, but things are stable most of the time. And yet you don't stop there. You're like, how can I take this experience and serve others and help others with what my family's gone through?
Mhm.
Led you to starting the organization that you're the co-founder for with Bear Inc. Would love for you to kind of take us into that story a little bit of, when was the first thought in your mind of, I think that we should start something. I'd love to hear from you
Yeah.
regarding the organization as well.
So I I've always just kind of felt like I needed to give back somehow.
Hmm.
I just didn't know how. Um, and one day when we were inpatient, his physician had come in and he's like, you've got a lot of energy. He's like, why don't you use that energy and put it towards something, that you would want to do that's good. And it because of Nate and because of him, because of his doctor, that's when I kind of decided I need to start doing something and giving back. And it started with just wanting to reach out to other families that have gone through or are going through biliary atresia and liver transplant, to joining other organizations and being part of a patient voice group like
Yeah.
Split, and the
Mm-hmm.
Starzl Network.
Yeah.
And then it just kept growing and getting into bigger and much needed more work, basically, for the community. And from there, it it didn't it didn't really it started out as wanting to give back, and it turned into a love. And
Mm.
I think that and you're always giving back, but when it turns into a love or a passion, then you're unstoppable. And
Mm.
to be able to, if my goal, especially with Bear, if I can touch just one more person's heart on living donation, or if I can move the needle on, no pun intended, move the needle on newborn screening for kids with liver disease, um, or advocate for something else that's just needed for these kids, for these families, then I know I've done what I've set out to do.
That is
Um,
such a beautiful desire. I love that. Thank you. I mean, for what you're doing. I mean, that's when I can see the passion. Clearly, that doctor that spearheaded this thought in your mind could see the passion too. When you think about, the many different things that are happening in the world of transplant right now, what are some of the things that you're excited about? Whether it's things that you're seeing with research, education within your organization, share
yeah.
a little bit about that
So
excitement and passion.
I mean, we transplanted 12 years ago, right? And now, 12 years later, I mean, transplantation has hit so many milestones. I mean, they did 1 million transplants, celebrated that. I believe that was 2023 that they
Mm.
celebrated that. Um, and there's so much more science towards transplant as well. You it seems like it's never ending, right? And kids are prioritized, which is, how it should be, in
Yeah.
my opinion, and I'm sure you would agree. But the prioritizing children in transplant is so important because, as we all know, they have a very long life to live. So there has been more movement towards, pediatrics and prioritizing them.
Hmm.
Other areas of transplantation, seeing these transplant centers really embrace the patient family voice, and
Yes.
the patient and family embracing them into their team, and not only just telling them what needs to happen, but educating them on what needs to happen.
Hmm.
I have noticed, in the past, I'd say 10 years, that 5-10 years, there's been that huge shift of transplant as well, where the patient and the family, and the physician have become more of a team.
There's a
Um,
lot more
there
collaboration
really
now than there
is.
ever was before.
Yeah, and I think that's great because and there's even collaborations among there's more organizations out there for transplant. And I think that's great for the patients and families, because when we went through it, um there weren't many organizations that you could lean on for support or get
Hmm.
resources from, or you had, if you were lucky, you were sitting next to somebody in the waiting room that you could talk to.
Yeah.
And then you have your own support and your team. And that was really about it. There's so many
Hmm.
resources out there today, that, I think is just much more helpful,
Hmm.
for the transplant community. So,
Yeah. Well, here in a moment, like I want to spend our closing time, asking your specific advice that you would give to parents before, during, and
mhm.
after on their transplant journey. But if you're game, we've got a couple personal questions just to get to know you as a human here in the meantime, if you're game.
Yeah, no problem.
All right. So, Jen, your favorite place to travel as a family?
Oh my goodness. I would have to say, and it's not that far, which is funny. I would have to say, Galena, Illinois. We go there every year for Thanksgiving. So we rent like this huge house, and it's my family, my husband's, my sisters-in-law, like we all collectively get together and enjoy a long Thanksgiving weekend in Galena, Illinois. And I think that beats any beach in my opinion. So
That's coming up. That's going to be
I know.
wonderful.
Yeah, yeah,
That's going to be
which we are going
wonderful.
again this year.
Uh,
So, yeah, so
I love
really,
it.
really excited. So,
Favorite movie of all time?
oh, oh my goodness. Devil Wears Prada.
Ooh, love it.
Yeah.
Love it. See, this is great. It
I
humanizes
know.
everybody
It
that's on the
does. It
podcast.
totally
This
does.
is so great. Last personal question before I ask you about your definition of perseverance, but a person living or dead that you'd most like to share a meal with and why?
I would have to say my Aunt Janine,
Oh,
who passed um,
wow.
on Mother's Day. She's been gone for 5 years now.
Wow.
Um, and she was my rock during
Mm,
Nathan's time. And she always picked up I miss her phone calls. I
mm,
miss her spunkiness and her sarcasm that I needed at times. She was a true spitfire. And she too was she was a breast cancer survivor, and just I really miss her. And if I could
wow.
have a meal with her and say, "Hey, look at what he's doing now," I
Oh,
mean,
yeah.
that'd be amazing.
We all need those people in our lives that have championed us and our families at places on the journey for sure. Like whether they're here or they're gone, like we miss them for sure. This next question is one of those that I started asking earlier this year to just about every guest on the
Hmm.
podcast, and it is always one of my most anticipated answers because everybody's shares something similar but different. And so here's the question: what does the word perseverance mean to
Oh.
you?
Don't give up. That's I mean, that is when you persevere, you are, first of all, you truly believe in something, and you just wholeheartedly just barrel through. You hit you hit every single obstacle, you hurdle over those, um, and you don't give up. You don't give up until, like, I know in my case, um, I didn't give up with Nathan until I knew that I just like there was nothing left for me to do anymore, right?
Right?
Um, and then at that point, it's in God's hands.
Yeah.
And in the medical teams and the surgeon. But I do feel like within that if you don't give up, you give your all, and if you can go to bed at night knowing that, then it was a good
Mm-hmm.
day.
Oh, that's beautiful. That's beautiful. I appreciate you sharing that.
Yeah,
Well, I mean, Jen,
it's a great
I
question.
Yeah, I really appreciate just your vulnerability and your passion. Like I love having guests on the podcast that are unique in that way that it's not just a bunch of information, but you can
Right.
clearly tell like that your life's been transformed by this story and now you're like leading out of that. Like it's authentic and it's personal. I really appreciate you bringing that to the table and sharing it with all of our listeners today. Um, you've got a unique perspective, not just as a leader, and running the organization now, but as a mom and as somebody who's persevered on the pediatric transplant journey. So maybe speak to those parents right now, whether they're
Mhm.
listed, whether they're currently in the hospital, maybe they're fighting the battle in the hospital or at home after transplant. What specific advice would you give to transplant
Mm.
parents that may experiencing this journey for the first time?
First, they're not alone. There are others that are going through it. So you might feel like, that while you're in the moment, that you are not alone, and that there are resources out there. There are other families to talk to and reach out to kind of help you go through some of the things that, only we as transplant parents really know what it's like. Um, and then we talked about earlier, giving yourself some grace. You have to. You have to give yourself some grace. You have to give yourself, I don't always say self-care, because sometimes that it's kind of a buzzword, but I do say give yourself me time,
Sure. Yeah.
whether it's grabbing a book and taking a cup of coffee and going to a chair in a window at the hospital where it's quiet and just reading and escaping from everything. Do that. Go for a walk. Take a nap, because I forgot to. So that's one thing I've learned, is take the
Yeah.
naps. But no, like, really just give yourself grace, give yourself me time,
Hmm.
and really truly find a way to really be part of that team that your kids' doctors and nurses are a part of, because it's going to be so helpful for you when there are times that maybe you're looking for answers, but there are none. You're going to need them as well.
Yeah.
And I think that leads to one last point, is that
Yeah.
just because you don't have the answers today or tomorrow, or you might not ever get an answer, um, to always just to continue to hope and believe
Mm.
in getting to the other side, which is transplant, right?
Yeah. Yeah.
Being that rock. So,
Mm. I see a common theme in all of your advice there and your insights of just the fact that it's collaborative,
mhm,
it's collaborative and we need one another. And I
mhm.
appreciate you sharing the fact that we're not alone, because I know so many families that are on the journey of transplant that they can have lots of great support systems, and my family being one of them. But the journey is still isolating and hopeless at times.
Oh yeah.
And so we need that encouragement from one another.
Yeah.
Um, I just really appreciate you sharing honestly, the real, the
Yeah.
raw, the vulnerable, the transparency. If somebody's really connected to your story, maybe they have a child that's been affected by biliary atresia specifically, maybe leave them with some ways to connect with your organization
Mhm.
online and find you guys.
Yeah, so anybody that is currently going through the process of, being diagnosed for biliary atresia, has been diagnosed, and, just going through that journey up into transplant, or even post liver transplant, they can they can go to our website, which is www.bearinc.org.
Yeah.
And then they can also,
My dog Lucy's a fan.
I was gonna say, like,
Yeah.
Lucy, hopefully not, needing any info.
Uh-huh.
Oh, okay, so
Lucy, did you
that's
know
a
that you were going to
doodle.
make an appearance? This is a golden doodle. Did you know that you were going to make an appearance on the podcast today?
Oh, so beautiful.
She's a fan of Bear Inc.
Yes,
Anyway,
she's a
where can we
big
find you
fan.
guys?
So you can find us at bearinc.org online.
Yeah.
And then I'm just going to give my email out if they ever want to reach out
Okay.
and need to talk or have ideas for the community. They can reach me. It's jennifer.lau@bearinc.org. So they
Awesome.
can reach me there. So
Well, we really appreciate all that you do for the organization. We really appreciate you sharing your story. This won't be the first and last time that we have you on the podcast, but we really appreciate you sharing your journey of perseverance. We're all better for it. So thank you, Jen.
thank you so much. It was a true honor today.
Hey, thanks so much for listening to the Pressing On podcast. If you found this episode inspiring and helpful in your journey of perseverance, we appreciate you sharing it with others. A great way to support our work of serving hospitalized families is sharing the podcast with family and friends, posting about it on social media, or leaving us a rating and review. Don't forget to visit our website at pressingon.org for our free programs and resources for hospitalized families. Follow along the Pressing On journey on Facebook, Instagram, and YouTube at Pressing On PGH. As we all press on through healthcare challenges, we need to stick together. Until next time, know that you are not alone. You are seen, valued, and loved. Keep pressing on.